holding that in the racks for a while. That's going to come later with the levitation. Good morning, everyone. We're ready to go there, cameras? Okay. It's really with great pleasure that I introduce the next presenter, Dietrich Klinghardt. It was kind of, I guess, fortuitous that we would get together and meet. Dietrich is a teacher par excellence. He has a tremendous grasp of what he's doing in neural therapy. And we met through neural therapy. In fact, we met in Canada. We met through he had a seminar up in Toronto. And I had the audacity to tell Dietrich what he should be putting in his injection solutions. But he thought it was a good idea, and so he inquired as to what we were about. He's finally sent his wife over to check out the seminar. He didn't come for one reason or another. And I guess the report was okay, that we were all right and we were on the right track. So next time he shows up. Dietrich has been a student of Franz Hopfer, probably the world's leading neural therapist. Dietrich has come to a unique place. He, I think, is very cognizant of the role that the teeth play in the genesis and maintenance of disease. I guess that's probably enough, Dietrich. Why don't you tell us what you're going to talk about today?
Good morning. I wanted to take a moment just say thanks to Ed. The first time I lectured here in the US was 3.5 years ago at one of his meetings, and I've never stopped talking since, since nobody stopped me. I like to catch everyone up. I had a couple of questions yesterday that people asked me, and I realized that we are quite a mixed group here, and so I wanted to spend just a few minutes in the beginning to just kind of really go back to the beginning and catch everyone up so nobody's left behind and you all know where we are. And I'm going to do two things this morning, like really I'm hoping I'm getting to it. One is I tell you about the most important health measure that any dentist here has to do for themselves, which is to detox on an ongoing basis from the mercury, amalgam, heavy metal vapors that you're exposed to. And I believe that we have now a program that is the best that is out there to monitor how well you're doing. And to get there, I have to kind of take you through a little bit of some stuff. And then the other thing I like to give you is how you can test your own patients and yourself, but also your patients in an expensive way and in a very cheap way. Whether they're candidates, for detox measures or not. For me, in modern dentistry, has become the most important healing modality, and I explain that in a moment why. However, most of you dentists here don't know that. Most of you dentists just kind of look through a small tunnel of what it is that you're doing, and you see the patient just for a short period of time. You don't follow them for a long period of time. You don't know what the dentistry that you're doing, what tremendous impact it has on your patient, and the tremendous healing that some of you are facilitating those patients. And we as physicians have sort of like a better place because we see these people over years in a more close way, and then see, they have the dentistry. If it's done right, there's these tremendous healings that occur. If it's done wrong, there's a tremendous downhill slope that the patient goes on. And most of you dentists here are not aware of that, or have not had the possibility of watching a patient over a long period of time. So I try to give you a few things today that are practical and that you can do for yourself. And hang in there. If I'm going too fast or too slow or I'm too boring, let me know. First, a few slides just to catch you up. This is actually where I started 3.5 years ago, and I'm just kind of try to give you a little bit something here. Okay, first slide. I realized a number of years ago, I have a pain clinic in Santa Fe, so I come to healing through a window that I observe chronic pain in people. And I created a number of years ago a summation theory of chronic pain, which says that chronic pain or chronic illness has basically 4 components that you need to address in a patient in order to get him well. Very different from an acute injury or an acute illness. Anyone who has chronic pain, which, and I want to always kind of refer to the people here in the room, which anyone here in the room has. All of you have chronic illness or are chronically ill in one way or another. You don't feel like you did when you were 6 or 7 years old. You feel different, and you shouldn't. You should still have the same vitality and the same life energy and the same health that you had then. But none of you here in the room, including myself, have that. And so you all fall into what I'm talking about. So chronic illness has 4 components. One is the structural component. I highlight here the treatment options that are on this level. The interesting thing is that dentistry is the only healing modality that addresses each component of chronic illness or chronic pain. So in this category would be the orthodontic work, the splinting, and so on and so forth, if you're a dentist. Next slide. Sorry, somebody needs to click the slides. Oh, this one here? I don't know. Let me see if I can make this work. Huh. Ed? Is Ed here?
Help.
Help.
It's in the way.
Maybe it's changed.
Hmm?
You got the next slide.
Already?
Move that
Dietrich, it's this guy here.
Let me see.
Yeah, this gentleman, I think he's blocking the.
Medicine, it's your fault. Did they just move on its own, or did you move it? Okay. So the second component is what I call the biochemical changes in the tissue. That's a component most of you are familiar with, because this is the only component that modern medicine works on, the chemistry, antibiotics, anti-this, anti-that. All your antis are in there and all your other medicines. B-venom therapy is one of the natural modalities in this category that I love a lot when you deal with chronic pain, But you also your vitamins, herbs, homeopathy, all that belongs in this category. This is the component also where dentistry works on in terms of your materials. Amalgam toxicity acts on this level. It blocks certain biochemical functions in the body and therefore destroys you on this level. Also like the other fillings, electrogalvanism and the other things we talked about, jawbone infections, all that belongs in this category. It interferes with your health on this level. A third component I call the electromagnetic disturbances. This is anything that interferes with the normal conduction of nerves in your nervous system. And I'm going to go deeper into this in my talk today. Neurotherapy is by far the most effective treatment on this level. And I'm also going to show a few slides what neurotherapy is, because we heard about that yesterday a little bit. The basis here is that the nervous system is electrical in nature. It's the transport of electrons that makes us feel, that makes our muscles move, that makes us think. And anything that interferes with the normal flow of electricity, such as magnetic fields or electric fields, works on this level. Electrogalvanism, again, works on this level. The dental interference field, if it's not infectious, and I'm going to talk about what that is, acts on this level. So again, dentistry is a major player on this level. Yeah. Next one. The fourth component I call the neurochemical changes in the brain. That's where psychology, psychiatry is at home, but also things like shamanism, psychic healing, spirituality, metaphysics, all that belongs into this category. And the technique I prefer on this level, it's the most, now the highlighted techniques on this level are always the most effective, fast working ones. It's a Downing technique. That's a technique using a light machine that influences the brain through light. And any light therapy works on this level. And laser therapy to a degree works on this level also. Again, your dentistry plays a big role here. If you have amalgam fillings, we all know now, should know now, that the lymphatic drainage of the teeth goes straight into the venous system of the brain, and from there directly into the brain cells. That means if you have any dental filling fit, within a few hours, the toxins released from the filling appear in your brain, affecting the membranes in the brain. And I'm going to talk about that a little bit later, how the metal ions that get transported through the lymphatics into the veins, into the brain, how the metal ions end up in the brain cells, screwing you up. And all of you here in the room who have any dentistry, this is the famous Arana axiom, anyone who has any dentistry in their mouth has a problem with that. Yeah? Whether it be crowns, whether it be ceramics, gold fillings, all of them leak over a period of time, and the part of what's leaking ends up in your brain, exerting a tremendous effect on it. And I personally think recently that in terms of the safety of filling materials, again, that there is no safe filling material, and that probably a good gold without palladium is the best material if it's cemented in, that all the other materials are inferior. We know that from recent observations in Germany that there's a big problem with the plastics in terms of the higher functions of your brain. You know, people that meditate and are in touch with those levels and they get a mouthful of plastic can no longer meditate and perform those higher functions. It's just a little warning I like to put out here. Glass ionomers seem to be the best filling material on that level. Okay. So this is the model I'm working with, and lots of people that work with me work with. We imagine chronic pain or chronic illness or health as a scale. And on the left side, which is the important side here for us, there's these 4 components that I talked about. If you want to get the patient well, you can either work one of these cups to death, which most of us have been doing until they heard me speaking, or you can address all these 4 components simultaneously, which means you don't have to be the world expert on any of these components. Just a little bit of knowledge in each of the components goes a long way. And my most successful students and friends in this category is Ara and Dino, who've really incorporated that in their dental work by combining their dentistry, using orthodontics work on the structural level, using the trigger point injections and neural therapy on the electrical level, working with a physician who's doing the IV vitamin therapy to cover the biochemical level, and working with the materials and covering the biochemical level and the brain part, and having tremendous healing results that are absolutely unheard of in the medical world. People coming in with wheelchairs and on crutches and dying and walking out after a few months of work with them, being normal again. And I know many of you here have observed similar things in your practices, but when you have this model working in your brain and really cover your ground, you start seeing fantastic results. Okay, this was just kind of to catch you up a little bit. Now a little excursion into neural therapy. For those of you who don't know what that is, this was a patient, an electronic engineer who builds nuclear bombs in Los Alamos. And he had a motorcycle accident 8 years before I saw him, ended up with a stiff left shoulder, which was his dominant arm. This is the range of abduction he had. Couldn't lift it higher than that. You see a splenectomy scar on the belly. We injected it. He gets within seconds, immediate increase in range of motion in his shoulder that he hadn't moved in 8 years. And next visit, we inject both the splenectomy scar and the scar from several shoulder surgeries where the orthopedic surgeons tried their luck on him without success. And he has full range of motion in the arm. 2 visits, cured patient. And when you start doing neural therapy, you see this a lot. You sort of wonder what happened if it doesn't happen. Now, just to off the bat, if somebody has a mouthful of amalgam fillings, you never observe this. Yeah? The toxicity created by the leakage from the fillings prevents this type of healing, which used to be one time in humanity, in the human evolution, the typical healing. Yeah? Somebody like 300 years ago, before amalgam fillings, somebody fell off a tree, ended up with a stiff neck or a broken leg. The local shaman came, they did their thing, in a few days they were limping around, but in 6 weeks they were okay. The reason we don't observe that in all the chronic pain syndromes, sympathetic dystrophy, MS, all the chronic neurological disease, most of that is caused, and I'm not exaggerating here, by your modern dentistry. And if you can use the dentistry to the advantage of the patient, then you get back to where you can observe this instant type of healing. And this is why I've become a part-time dentist, because I've realized that the difference between being able to be a wonderful healer and do this magic on people all the time is not whether you're good enough to do it or the patient is qualifying. It's just the level of toxicity in the patient that determines that. And I'll go deeper into that later. Just kind of to conclude this part of my talk, this is Santa Fe and fall. Just a few cases. This was a young actress with severe migraine headaches. You see the scar on her arm, left forearm. We injected the scar once. The patient was cured. 10 years of migraine headaches. Low back pain, post-discectomy pain very often is just simply the dysfunction, the electrical dysfunction originating from the scar. Often one injection is the end to your patient's pain versus 2-3 years of physical therapy and the life of disability, being on workman's comp for the next 7 years and not working for the rest of your life. One visit, one treatment, if the patient has a clean mouth. Stellate ganglion block, I just show that we also inject autonomic ganglia quite a bit, which are always a very, very important part of the dysfunction, and I get to explain why. For example, in the mouth, when you have a mouthful of toxic fillings, one of the routes that's the least mentioned in your books is the nerves. Toxins travel along nerves through a mechanism called axonal transport. And the toxins end up, like your mercury ends up in the Gasserian ganglion. Yeah? If you have poor filling materials, within a few days, your Gasserian ganglion becomes toxic, becomes loaded with metal ions that stay there for the rest of the life of this patient. And what happens then, now you get in a car accident, some of the ligaments in the neck get strained, and there's additional neurological input into the trigeminal nerve system, which now goes on overload because it's already at the edge of compensation. It cannot adapt anymore because the ganglion is so toxic. In order to free up the ganglion, you have to either inject it with local anesthetic or run an electric current through it, which simply electrophoretically or through the electric mechanisms we discussed yesterday transports the ions out of the ganglion back into the tissues where the lymphatic system and the venous system can transport them away to other sites in the body. So we no longer inject the deep ganglia. There's wonderful electrical machines that we teach in our workshops that can do the job, that you as a dentist also can work safely if you understand where to put the electrodes and what instrument to use. Okay. This was a patient with severe facial pain after failed jaw surgery. Jaw surgery for me is the most cruel, inhuman, murderous thing that was ever invented because it's always done by people who don't understand any of the 4 components, who never do their homework with the patient and do the surgery much too soon. It is very, very extremely rare that somebody would need surgery, if ever. And this was a patient who was sent by a patient I saw, low back pain, she did wonderful, was sent by her attorney to one of these TMJ surgeons just to get a little bit more squeezed out of the workman's comp, out of the money thing. And he decided, of course, immediately to operate her because she had a little clicking in the jaws, completely destroyed her life. You see, like, she has a Horner syndrome on the right side, severe right-sided facial pain, and the only procedures that give her relief for about 2 to 3 weeks at a time is a ciliary ganglion block. That's an injection deep under the eye, where the needle tip sits behind the eyeball, and a sphenopalatine ganglion block. It's just to show you a little bit the range of the treatments. Yeah, this is a tonsil injection. Tonsils, behind the tonsils is a deep lymphatic drainage for the brain. Whenever any one of you here, all of you who are dentists, are amalgam toxic in your brain, there's no exception. I can say that categorically because I've tested many of you and I know. And one of the easy ways of flushing down the amalgam from the brain, of facilitating the transport, is by opening up the deep lymphatics that are deep in the throat. There's not one medical textbook that states that, even though we know that from some studies I did when I was in medical school, that the lymphatic drainage of the brain is not like it's in the books on the outside of the skin here. It's right behind the tonsils. And if the tonsils are scarred up from infections or operation, those lymphatic channels are constricted and you get back up in the brain, and the mercury in your brain never leaves there because there's no lymphatic flow. Simply by injecting the tonsils, you clean up the lymphatics, they dilate, and it's like putting Drano in the toilet. Procaine or Novocaine. These are just some aspects of the teeth. These are all cases of chronic craniofacial pain relieved by doing dental work. On the lower right, you see an overfilled root canal. There's various forms of osteitis. There's a little bit of amalgam here on the left, all causing severe neuralgia in the face that was completely cured after treating those teeth. Now, Chris is going to go deeper into this in the next talk. For me, it's now become standard. You know, most low back pain, most neck pain, most cancer, most chronic kidney infections, glomerulonephritis of the kidneys, hepatitis, most chronic illness, heart disease. Heart disease, until proven otherwise, is an osteitis or osteomyelitis in the wisdom tooth area. You know, I've not have one exception to that rule. You know, people that had already their second bypass surgery, we clean up the jawbone in the area of the wisdom tooth, and these patients are cured and they live another 50 years. You have to kind of kill them in order to get rid of these people, even in their 90s. Once you fix their teeth, they won't die. And it's become that strong for me. Most neurological illness is in the teeth. You know, MS, ALS, migraine headaches, chronic pain. I treat the patient in a reasonable way with neurotherapy, doing some prolotherapy, some manipulation. If the patient doesn't respond very quick within very few treatments, we get the dental x-rays and I send them. Fortunately enough, all the dentists I'm working with are in this room, and I'm really happy that you guys are all here. This is just for me really touching. If they have amalgam fillings or restorations that are incompatible with them, I have those replaced. I don't see the patient until that is resolved, because I know I'm going to work myself. I want to work my butt off with this patient to get him well. I'm going to do epidural injections, and I'm going to do all these risky procedures that I know they're kind of going to put my life as a physician on the line. I'm going to nudge them a little bit more, you know, towards health. I stop doing that. First visit, I look at them if they have a mouthful of amalgam, and I'll show you the test later. And I know the amalgam films contribute. Cloud up is biochemical component that we talked about. There are significant influence. I do not treat that patient. He goes and sees Chris Norton, who sits back there, or Bill Wolf, or Lauren Lavick, and the fillings come out. The patient comes back. he does not feel one bit better usually at the time. Yeah? Remember, the fillings are never the problem. It's the amalgam that has escaped the filling that is now in the nervous system that's the problem. Then I start the detox program that we talk about, and then the patient within 3 months usually is well, with very, very little work on my part. And this is, of course, the most overlooked component in medicine, and I just want to really tell all of you how important your part is in this, and that you don't stop coming to these courses and learning to improve your techniques and your material testing. The material testing, you know, what you put in the mouth is probably the most crucial part for you dentists, and I do recommend that every one of you uses Jess Clifford's blood test. Just sitting back there, he will talk later. Those of you who have not used the test, please do. You prevent so much illness that most of you I know still don't believe it, that you do, because you don't see the patient over the long-term periods that we do. You have to use one test to test the materials before you put them in. And the blood test is available for all of you. All it takes is drawing a little blood, and any one of you can do that. Now, if you use electroacupuncture, fine. If you use muscle testing, fine. But if that's not easy for you to do those methods, at least use the blood test. It's a wonderful, easy, reliable way of getting in the ballpark with your materials and not screwing up this patient, especially in your neurological patients. If you have an MS patient or an ALS patient or a chronic pain patient, which is every patient that you see. Tell me one patient who doesn't have some chronic pain problem. At the moment you put in the wrong filling material, you perpetuate this patient's problem for life. You shorten their lifespan, you're crippling them, you're destroying families. And with a $200 test, you prevent that. And so I really urge you to work with those methods. Very simple. If you suspect a tooth causing a problem, and the patient, for example, like this patient has chronic severe sciatica, we traced it down with muscle testing to one of the central incisors. We put a test injection, local anesthetic there. You see the straight leg raising test before. This is how much you could raise a leg up before she got severe low back pain. After the injection, full range of motion, no pain. In this case, it was a pulpitis created, or it was a piece of necrotic bone in the tooth created by the high-speed drill. Yeah? So all of you, just kind of to sum that up, I urge you, when you do fillings, use a high-speed drill to get the old stuff out and to get the lot of the decay out, but use a slow-speed drill to do the final drilling that doesn't heat up as much. This was just from overheating of the tooth. 11 years of most severe low back pain, crippling back pain, 2 disc surgeries, and on and on and on, just from one dentist who was a little bit impatient. Yeah? It would have taken him how much longer? Maybe a minute longer to do the same filling. It would have saved this patient 10 or 11 years of severe agony, destruction of a family, of a whole life. Yeah? So just keep that in mind every time you hold that drill. Think of my talk here. Okay, that's as much as I want to do with the slides. Oh yeah, there is Don's slide. Don, it re-emerged. It kind of got stuck in the thing here. No, but somebody would you we kind of take out. Now, would you help me with the transparencies? Are you guys with me so far? Am I going too slow or too fast? You had a question?
I have a question that may be premature, but yesterday we talked about non-surgical approaches to these problems.
Yeah.
And I have a conflict in my mind about it, and I'm wondering whether you believe or have experienced resolution of these problems like the jaw osteitis or amalgam toxicity with non-surgical approaches that are definitive, long-term.
Yeah, with the amalgam toxicity, we're going to talk about that. And with the non-surgical approach to the jaw osteitis, Don Bartram gave us yesterday a wonderful talk. and I had heard him talk about lasers 4 years ago here, and I said, that can't be. This must be one of those Crocodile Dundee guys, you know, who's just fooling us, and he's got a knife in his boot, and we can trust him. So I went out of my way and went out to Australia to see him in his practice, and I saw, first of all, one of the most well-organized dental practices I've ever seen. And I saw, watch people in the waiting room. You're coming in on crutches and walkers and carried in, and after being there for an hour and a half, walking out, flying out, dancing out, this one after another. So anything that Don said yesterday is true in my experience. So if that helps you, we do have a source for a decent laser here in the US. And if after the talk maybe you want to come up and put your name on a list, and I put you in contact with that person, it's about $1,000. But Chris is going to talk about his way of treating the bone cavitations, and I do believe that there is a firm place for the surgical solutions, and we use some injectable remedies. We're very close to having a whole host of non-surgical solutions. One is 2 of the Sanum remedies, Pefrakil and Arthrochelan A, and one is the dental laser. Those 2 things have been absolute winners. If you do it right, and you have to use kinesiology or electroacupuncture to know when to do what and how much and where exactly. And we get to that at the end of my talk. Okay, now. Arthrochelan A. But I can't say any more about those remedies. They may be passing the FDA criteria in a few months, and we hope for that. Would someone help me with the overheads, putting them on? Chris, yeah, thanks. We just kind of go through the things one by one, and so in a fairly rapid order. You get yourself a chair, Chris. Thanks. Let me just kind of ask the question again that was just asked. Basically, the question is this, and I know I'm repetitive here to some people, but when you're in medicine and you have a heart that's ill, you have heart medication, you got homeopathy, you got various kind of exercise programs, diet. These are already 4 different methods of getting the heart well. Then you got surgical approaches, at least 20 of them. If you have a sick tooth, you have 2 approaches. Either you kill it, you put a root canal in, or you take it out. And that just doesn't seem like the 1990s. And so we're continuously working on finding ways of healing the tooth. And that's a concept none of you have learned in medical school. And we're injecting homeopathics, we're injecting the Sanum remedies, we're using the laser, we're using diet and nutrition and getting the gut right. There's various ways of doing that. In my opinion, the expert here in the country on healing teeth, from whom I've learned the most, is Louisa Williams, who is sitting right there, who's taken this concept to the furthest in saving teeth by in a very sophisticated way, muscle testing, finding the right remedy, injecting it around the tooth, and healing the tooth. And it's been tremendously, for me, like since I've adopted her system, how many teeth can be saved from even the most simple dental work. But it's unbelievable how many root canals we prevent, how many tooth extraction we can prevent today by using those simple tools, the laser and those injectables. But that's not the subject of my talk here. We do teach workshops in New Mexico, and we have one workshop I recommend for all of you. It's a muscle testing workshop we do in March. This next one is booked out, but we have one in March coming up in Seattle. I recommend to all of you, where we go in detail into the dental testing. It's mostly meant for dental testing. It's a 2-day workshop. We just show you, this is what you do, these are the remedies that are available, these are the lasers that are available, and this is how you test for it, and this is what you do with it. Okay, so just a very quick expedition into the autonomic nervous system. You got two parts of it. On the left side is parasympathetic, right side is sympathetic. The main reason I show this is that wherever you see the word ganglion, these are the cell bodies of the nerve cells, and these go toxic with heavy metals, and these become toxic for a lifetime unless you find a way of getting the metal ions out of those ganglia. And whatever ganglion is dysfunctional, its influence area in the body is going to be dysfunctional. Yeah? Cold hand, cold feet, chronic depression, chronic arthritis, eye problems, ear problems, heart problems, lung problems, you can go down the list, and gut problems. Wherever the dysfunctional ganglion is, you're going to have dysfunction in that associated body part. Yeah? Autonomic nervous system regulates the blood supply to everything. If the ganglion is dysfunctional, you're going to have constricted blood supply to that area. You know, if the celiac ganglion is dysfunctional, if you have dental fillings put in, and over the next few weeks you leak out a lot of the fresh, nice, beautiful mercury, goes down your gut, gets absorbed, and it's a myth that it gets absorbed into the bloodstream. Most of it immediately gets absorbed by the nerve endings, which are constantly sampling their environment and externally transported to the next ganglion up, which in the gut is the celiac ganglion, solar plexus, which becomes dysfunctional, misfires, and from there on for the rest of your life, it constricts the blood supply to the gut, to the liver, to the kidneys, to the pancreas, and then piggyback on that comes the liver cancer or the pancreatic cancer, the kidney cancer, in the extreme case, or just simple dysfunction, the amoebas, the giardia, the worms. Yeah? It's a myth that we all have parasites because we're exposed to them. We get parasites because our immune system doesn't freely circulate antibodies through the gut wall because of the toxicity of the celiac ganglion. Now, the amalgam fillings are only one part of the problem. There's other sources of toxins, chronic viral or acute viral infections, bacterial infections. The toxins get sampled by the nervous system, end up in the ganglion, stay there for the rest of your life until you detoxify the ganglion. Okay, next slide. Okay, just let's jump this one. Next one. Okay, I always get asked, well, how do the sympathetics travel into the brain? The sympathetics follow the arteries and blood vessels, and if you want to detoxify your brain, you have to open up the sympathetics that constrict or open up the blood supply to your brain. Chronic fatigue at its bottom line is either toxicity of the brain or a constricted blood supply to the brain. By opening up the blood supply to the brain, you detox the brain. So the ideal way of treating chronic fatigue is treating the sympathetic nervous system portion that opens up the blood supply to the brain. So most of our injection points are along those arteries. And let's not go further into that. Just a little excursion for those who wonder. Nerve transport system, axonal transport, just to show you there's a lot of references on how that works. Next overhead. Okay, now this is the ground system that, Chris, it's upside down or left, right, something like, yeah, okay. The ground system, this is an electron microscopy from Pischinger. The ground system is another fancy word for the extracellular space. If you have a lot of amalgam fillings, where does the amalgam ultimately end up? Well, it ends up at first in the ground system, because down at the bottom, this red thing, that's the end of the supplying artery. Yeah, the artery ends like a big garbage pipe. You know, on the beach, you see those, ends up freely in the connective tissue and dumps the blood, you know, into the area, which then gets grabbed up by the lymphatics, axonally transported up the nerves, or ends up passing into the cells, you know, that you see up in the upper part of the picture. Now, if you circulate a nice amount of daily mercury, copper, tin, nickel, and so forth through your system, this is where it ends up. It gets dumped into the connective tissue and then gets grabbed up by any of the possible things that are there, the nerve, the vein, the lymphatic, or the cells. Okay, next, overhead. Okay, now here is a book. Those of you who are interested in going deeper into it. I'm always saying something that I think still is the truth. The big difference between medicine and healing in Europe and the US is that you guys here are all way overtrained in your biochemistry. You're looking at life, especially medical life, through the eyes of a biochemist. And if you're trained in Germany, you look through the eyes of a physicist. And so I feel it's my part in life, like, to give you guys a little bit of physics, and this is part of it. Understanding how membranes in the body function. How does mercury get inside the cells that we just saw? It has to pass through what's called ionic channels. And most of you remember the calcium-potassium channel, or the sodium-potassium channel, or the sodium-potassium pump. Now, that was then when you went to medical school. Now, we got way over 120 different channels in each cell membrane. And I'm just taking you here through the index in front of the book. This is a book that just came out. It's the best compilation on the subject. It's just kind of for you who wonder, how does the mercury end up in my brain cells? How does it get there? Does it just kind of freely float through the membranes and end up there, or what happens here? So, just to give some answers to that, we just go through the index of this book, and I've highlighted a few things in there. Okay, ionic channels are pores. Channels and ions are needed for excitation. So ionic channels are pores. It simply means channels mainly are holes in the membrane of the cell. And channels and ions are needed for excitation. Excitation means for the nervous system to function, to be excitable, to transport any information along your body. You need to have channels and you need to have ions. Ionic selectivity, that chapter basically says that our channels that we have in our cells are not very selective. That means if you have a calcium channel, it may transport nickel through it, it may transport cadmium through it, it may transport a whole host of different metal ions through it. The channel doesn't think. Whatever floats around may be transported through a channel or not, and that depends on various factors. Now at the bottom, drugs and toxins act at receptors. That simply means that anything you put in the body may interfere with the transport at the receptor sides. Receptors are the opening of the pore. Any cell wall that has a hole in it, that's an ionic channel, and at the outside of the cell wall is a receptor that determines whether this particular ion or toxin that floats by is acceptable for this channel or not. And when in doubt, it usually opens it up and lets it come in, let the cell deal with it. Okay, axons have similar channels. That just says that nerves along their axons also have channels, and this is how the crud gets into your nervous system through axonal transport. Unfortunately, the axons are not closed kind of pipes like rubber tubes, that are sealed at the end. They have openings all along and sample their environment all the time. Anything that's in you ends up in the nervous system. Next slide. Multiple channel types coexist in the same cell. There's up to 120 different types of channels. Channel opening is voltage dependent and delayed. So that means the channel can be open, can be closed, and the only thing that determines that is the electrical voltage. Now in neurotherapy we inject local anesthetics. Local anesthetics create a charge of 200 millivolts. What that means is 200 millivolts is a charge range where all channels are open. And most cells have become dysfunctional and toxic. Their charge drops down to 40 or 50 millivolts. That is a charge at which all pores are closed. That means once a toxin enters a cell, and this is, I think, the peak point of my talk here, once, let's say, a mercury ion enters into the cell, it changes the charge of the cell because it's, as an ion, it's interactive with other ions, and it changes the electrical charge. Once a mercury gets inside the cell, usually the charge of the cell drops down to about 50 millivolts. That means now the pore closes behind it and it cannot get out. It's trapped in there. And with the mercury in the cell, the whole cell becomes dysfunctional. The pores are closed, no new nutrients can come in, no toxins can go out, the cell is stuck. It exists still as a vegetable, but it doesn't participate in the dance of life anymore. And this is true for most of you here, in your brain cells and your kidney cells and your liver cells, and probably a couple of others too. Yeah, you all follow me at this point. We're talking about something important here. Let's just kind of see what else is here. Okay, next slide. Oh yeah, just back to the local anesthetic. So one of the ways of revitalizing your being is to inject lidocaine or novocaine. Now, Chris and I and Ed, like we all discovered the wonders of intravenous lidocaine. That's one of the ways you can get lidocaine into your brain, and it's one of the ways you can open up some of those pores in your brain to give your brain a chance to pump that mercury back out. Yeah? But there's also several other neural therapy techniques, like injecting along the arteries in the brain, in the face, the crown of thorns and other techniques that help to open up those pores. That's the first job. You cannot detoxify someone without opening up the pores. And most detox procedures that I look here in the US are based simply on understanding of chemistry and not based on the simple physical truths. And you cannot do a detox program without opening up the pores. And I'll show you some cases that made my hair stand up when I really understood what they meant. Next slide. Let me see if there's anything. Dehydration, reduce mobility in narrow pores. That means simply by hydrating someone, by giving them a lot of water, you open up some of the ionic channels. So again, you cannot detox someone unless you open up those pores. That means hydration is very important. Ions must overcome electrostatic barriers. Yeah, same thing, if the membrane potential is not 90 millivolts or more, the pores are closed, the cell cannot transport ions in or out of the cell. So you have to get the charge right first. Intravenous vitamin C is one of the ways, and there's all this bullshit out there what vitamin C does in terms of detoxing and all this and that, you know, and it doesn't work. But what vitamin C does, it supplies free electrons to the ground system, to the connective tissue, and helps to restore your normal membrane potential so that the pores open up and your body can even start to detox. Yeah? But vitamin C, in my opinion, doesn't do anything helpful in terms of the biochemical component. I think that's all bullshit. Next one.
Can we quote you on that?
Yes, please do. Some channel must hold more than one ion at a time. Well, local anesthetic alter gating kinetics. I already talked about that. Your local anesthetics are one of the major means that we have to get the cell wall open, crack the cell wall open and get the stuff out of there. Okay, let's do the next one. Okay, it just basically the top one says external calcium ions shift voltage dependent gating. It simply means when you have a good dose of calcium on board, your channels tend to open up. Next slide. Okay, so there was just a little excursion into the physics of the cell wall. Gary?
Who's the publisher of that book?
I have the book upstairs. I'll bring it down in the break. Hmm?
On the front page.
Okay, well, Gary, I bring that book and the other book that I'm working with down here in the break and put it here up front so any one of you is interested. It's an excellent book. If you can translate, you know, it's not written for dentists, but if you can translate just the simple statements in the book into what I just talked about, you'll understand the book. It's very easy reading, very beautifully written. Okay, now we're getting into the more serious part of my talk here. DMPS, yeah, one more question, okay.
What about the synergistic effect of, like up here you're showing copper. What about the enhancement of the mercury or the other way around of the copper on the system? Did you mention anything about that?
Well, let's first talk about this. Hold your question until the end of my talk, because it may be clarified by then. So I've looked now over the years. I looked at Sam Ziff's program, I looked at everyone else's program and tried them out to get my patients detoxed. But I'm one of the people who's not easily fooled by anything that I'm trying. I have a patient here with chronic migraine headaches. I diagnosed using my kinesiology that removing his toxicity levels should take care of the migraine. And if 3 months after the fillings are out he still has a migraine, I know something is wrong here, not working. So I tried all the detox programs that are out there, and I came up with this agent which works better than any other agent out there in order to get the mercury out of the body. The German name is Dimerval. It's a synthetic amino acid which was initially synthesized in China, where they were looking for workers that work in lead mines and were all dying left and right of leukemia because lead ends up in the bone marrow. They were looking for agents that they could give people on an ongoing basis that would keep the system current. And they found this compound already in the 50s and confirmed already in the first studies that none of their lead workers died anymore from bone cancers because it works so effective. So this is named Dimerval, and I'm just going to say the name once, dimercaptopropane sulfonic acid. I'm going to stay with the word DMPS. There is 2 chelating agents that are very powerful. One is DMSA, this dimercaptosuccinic acid, and this is propane sulfonic acid. And just to say that off the bat, in front of my talk, DMPS, this agent gets excreted through the kidneys exclusively and is the agent of choice to get your kidneys unplugged. The pores, and again, the kidney membranes function as ionic membranes, as pores as the ones that I just described. The reason you pee is because you have water and minerals passing through those pores that we just described. And those pores get plugged up with the mercury. I had my fillings removed when I was 27. I had a mouthful of silver. And 6 weeks later, unfortunately, I was traveling in India. I had diarrhea a few times. I was dehydrated. 6 weeks later, I was dying of kidney failure in India. This is why I'm very adamant about the subject, because it almost cost my life having my fillings removed and not knowing anything about detox and not knowing anything about the physiology of what was going on. And anyone who has their fillings removed, or any one of you who is involved in that, anyone who's placing fillings, has to be aware that for the few months following this procedure, either putting fillings in or taking them out, your ionic channels in the kidneys get plugged up with copper ions, with tin ions, and with mercury ions. And you do not excrete properly. And you get a backup, and the kidney gets rotten. It gets in a rotten state. If you take those kidneys out, they look horrible. We looked at a few of them in pathology in people that just had a bunch of fillings placed. The whole kidney is inflamed, swollen. It looks like the kidney of a dying person. Now, this passes by unnoticed in almost everyone. Nobody talks about that. But therefore, this agent is the ideal agent to get the stuff out of the kidney pores. With one, we use it, there's an IV version and an oral version. The IV version, it's a 250 milligram ampoule. We get that at College Pharmacy without any problem. Call up College Pharmacy in Colorado Springs. It's expensive. It's $62 a shot. Any dentist here in the room should have approximately a total of 5 shots once a month, and then go back on the other detox program that I recommend. So DMPS gets the stuff through the kidneys. It's the only stuff out there that cleans out the ionic pores in your kidney. There is nothing out there that does that job.
Is the IV superior to the oral?
Yes, I'll show a few slides. I'm going to clarify that in a moment. Now, Louisa and I have worked out the detox program where probably you can get away without using the IV, but not when you're a dentist. In order just to get current from dental school and the damage that's done already, you cannot do it without this. DMPS is an oral agent that's in the PDR under the name Chemet, C-H-E-M-E-T. It's very expensive if you buy it through the PDR. It's very cheap when you buy it in Canada at Cribbs Pharmacy in Vancouver. DMPS gets the stuff out of the brain and excretes it through the gut. 70% of the mercury that comes out with the DMPS, it's an oral agent, comes out through the gut. It doesn't come out through the kidneys. Only 16% go through the kidney. Sorry, DMSA, yeah. It's DMSA, dimacaptosuccinic acid. The protocol there is, and I just like to get that off the bat in case I kind of lose my time here or whatever. DMSA, the dose is, it comes in 250 milligram capsules, 2 capsules 4 times a day for 3 days in a row. And you repeat that after 2 weeks. You can repeat that every 2 weeks. Usually we don't do that more than 3 times total.
Repeat the last time. Repeat the whole thing.
You repeat it's 2 times, 4 times a day, so 2 grams a day for 3 days in a row. Then you stop for 2 weeks and repeat it after 2 weeks. During those 2 weeks you take a lot of trace minerals because you're losing, with any of these procedures, the only side effect you're ever going to see in your life as a physician is that you throw out a lot of good minerals, especially zinc and copper, and you may get deficient in those. So you want to supplement minerals in the interval. Stop always 24 hours before you do any of these procedures. You stop taking any minerals, calcium, potassium, magnesium, trace minerals. You have to stop, otherwise all you're doing is you're binding the DMPS or DMSA to those minerals that you just took, and you get these nice complexes and they come out in the urine or in your poop, and you lose the effect of the medication. So be aware of that. Okay, now let's go in the more interesting part of this and looking at some of these things.
Dietrich, if you give DMSA,
Mm-hmm.
do you have a problem with the elimination of the DMSA bonded material if the kidney isn't taken care of with DMPS?
Yes, the trouble with the DMSA is that the most damaged organ in all of you here who are dentists is, hell with the brain. You know, anyone can live without a brain, but you cannot live without your kidneys. And the only way to clean up your kidneys is the DMPS. Now, I'm going to come to another detox way at the end that is probably going to resolve all these problems. So hold your questions for now, unless it's something I say the wrong word and and I'm not clear in what I'm saying. But try to hold your questions until the end of this. This is Doundera's book. Now, Dounderer is the main European toxicologist. He is in Munich, who started using DMPS since 1980 to test a lot of people on it, and who's done a lot of research on it. And I need to kind of refresh my memory and look at the slide myself. Hang on, Chris. Can you? Okay. I think you can understand me. This is a comparison between oral DMPS and IV DMPS. And you see the excretion curves here. This is 24 hours. And this is the amount of mercury coming out through the urine. And you see here, this is 38.7 micrograms of mercury. And this is 16.7 micrograms per mercury. This is the oral, after oral DMPS, you get this curve of excretion. Yeah, but remember, this is only 16 micrograms. And this is 38, more than double the curve that you get after the same dose of DMPS IV. Yeah, just to clarify that issue. If you're more comfortable in using the oral form of DMPS, use the oral form. At least, I mean, you still get your kidneys cleaned up. It's just going to take longer. It's cheaper on a per weight doses.
How do you use it orally?
The oral, I don't know actually. I've never used it orally. It's on the instruction. It comes in a box of capsules, and it says in there how to take it. No, I don't know. I believe from college pharmacy you can only get the IV form.
No, they started making the oral form too now.
Oh, okay.
$50 a pill.
How much?
$50 a pill.
$50 a pill. Yeah. So I recommend you stay with the IV and find somebody to inject the IV into you. Yeah, it's a slow IV shot. Okay. Next, Chris. Okay. Okay. This is just one of the studies Dandura did, you see the on the left side, left axis, is the logarithm of the mercury concentration, and you see, and on the bottom is the number of silver amalgam fillings in the patient, and the simple thing stated here is the more silver fillings you have, the more mercury comes out of you when you give the shot. That's what this slide is saying. Next. And this is a study that was done at the University of Arizona. That was the only study in this country published on it, which confirms basically all of Dandura's observations. A wonderful study that kind of we use as a backup while we're using it. I sent it to the insurance companies a couple of times with good results in them paying for the shot. It basically confirms that the more amalgam fillings you have, the more mercury is in you, the more comes out with this test.
Can we get a copy of that?
Ed has the article. What, I have them? What?
You can order.
I recommend, one person that can send you a copy easily, that's more reliable than me with my staff, is Merlene Brake in Albuquerque. She's the national leader of the DAMS, Moving Dental Amalgam Mercury Support Group, and she sends out reprints of all the articles. This Merlene Brake.
That's right there.
There's an address there.
Biometals, Post
Biometals.
Office Box 42482, Tucson, Arizona.
Okay, yeah,
Just copy that.
yeah. Let's just keep that on there so we can copy that address.
You can also call Apashian and he'll send it to you. In Tucson.
That's what it is right there.
His name is on the first one up there.
We get a little bit more into the protocol, and at the end, please ask me questions until you kind of know exactly where to order what, when, how much, and all that, so that's all clarified. Because I do want this group of dentists here in the room to be the surviving group of dentists. If everyone else goes down the drain,
Yes.
that's not our responsibility, but I feel responsible for you here. So, the next slide. Okay, so now we get into some cases here. Now, what we do is this. The patient gets a shot with a one vial of DMPS at 250 milligrams, slow IV over about 3 or 4 minutes. Then for 24 hours we collect the urine in a container provided to us by Dr. Statter. And Dr. Statter is a lab somewhere
Chicago.
in Chicago. Okay, so you all can call information in Chicago. The number is on there, and we can read that or write it down somewhere later. It's the most used lab. And what you order is a special mercury and urine elements. There are those two things. Elements and special mercury. Now, unfortunately from this position where I'm here, I cannot see anything on this thing, so I'm going to move my thing forward here.
You want this? You want a pointer?
Well, let me just kind of...
Put it on the room charge.
Maybe. Okay. I think that's okay, huh? So, this is a patient, a young lady from Switzerland, 17 years old, who had seizures ever since she was 8 years old. Twice a week, 3 times a week, grand mal seizures. We did 1 DMPS shot on her. The date, you see it at 9/23/93. Now, what do we have now? It's about 10, what's October?
1023.
It's 10/23 today.
And so 1 month ago. And I know as of 2 days ago, she has had not one seizure since we gave her the DMPS shot. And let's look at the urine. You have a fairly normal or low elevated mercury excretion. That's 3.2 micrograms of mercury excreted in 24 hours. But let's look at this on the left side here so we all talk the same language. The elements listed up here are basically the elements that we need in our body. These are trace elements that are important for us. All of these should be 0. We should not have any of this in us. Yeah, in a healthy person, you find all of these 0. And see what's coming out of her. A tremendous amount of lead, tremendous amount of nickel, and so on and so forth. Zirconium, aluminum, and so forth. 1 DMPS shot curative in terms of her seizures. Now, of course, I gave her, a few days ago, I gave her another shot to see where her levels are, and we're not going to stop until she's all the way down. Yeah, her father is a pharmacist, which was interesting for me, because I know I'm going to have the whole of Switzerland coming to me now for the seizure patients. Next overhead. This is a patient with MS. Now, we're getting now into interesting aspects of where is the mercury in the body and where is the heavy metals in the body. Now, she has a quite elevated mercury level here. Yeah, 22.4 micrograms coming out in 24 hours. You see on the scale here, so it gives you a little idea where we are. This is part per billion, so it's a different scale than this one. This is a better measurement. And you see on her first visit, yeah, elevated mercury level, but no heavy metals coming out. Yeah, she looks pretty clean here. Elevated tin level. No, tin isn't good. It's toxic, but there's only one heavy metal, and you think, well, MS must be coming from something else. Now, next slide. Now, interesting enough, now we've started to detox her, started to put her on some things. The first one was, I believe, in May. Now we're in July of this year. You see her mercury level? It's not, now they changed the scale at Dr. Stella. Somewhere this summer they turned it sideways, because I figured it was a big improvement. I don't know, the bureaucrats see on those things, they sort of like to, in order to justify their positions, once in a while they need to change the thing. So down to 4.2, and now the interesting thing happens, that now the lead is coming out, now the cadmium is coming out, now the zirconium comes out. Yeah? What has happened in this patient, and this is like the next patient who is here in the room is going to be more evident with this, but what happened here is a thing that I've observed now ever since I started doing this test about 2 years ago, that when you have even moderately elevated level of mercury in your body, it blocks the ionic channels, and all the heavy metals that enter your body can no longer come out. Our body is perfectly prepared to throw out nickel and tin and copper and lead. If it's not too much, moderate amounts input with the drinking water and the food, the body is perfectly prepared to throw those out. The moment you put your few amalgam fillings in that mouth, those detox mechanisms no longer work, because the ionic channels, the pores, get plugged up. A little bit of mercury that gets inside the cell changes the membrane potential, your cell closes down, and everything stays in the body. And what happens here, the wonderful thing is, we get the mercury out, we get the mercury level down. The moment the mercury level is down, the other heavy metals come out. And I've had patients, and you're going to see one of the cases I'm going to show, a patient who had years of chelation therapy with no improvement. We did a few of these shots, we put him on chlorella, and I'm going to talk about that quite a bit, a new detox agent that we found that's absolutely fantastic. We put him on a moderate detox. The moment we got his levels of mercury down, huge amount of lead, cadmium, and so on and so forth come out, and the patient gets cured. How did this patient feel in this moment? What's your guess? That's the day when she was out of the wheelchair. Yeah? A few days before we got the test back, she called me and said, this is the first time in 10 years I can walk. Yeah? Next slide. This is the third one. You see the mercury level first dropping down more. Now look at this. Yeah? The reason she felt good after that second shot was because the lead that came out was almost all the lead that was in her. You know, with the third shot, there's no more lead, no more of the other crud coming out of her. We've cleaned her out. She's completely asymptomatic now.
How far apart are these?
Well, you saw the dates. This is 9. Yeah, the first one was May. Second one was July. This is September. Okay, next one. Okay, this man is here in the room, and he allowed me to show his chart. Chris, would you mind raising your hand in case anyone has any questions? Okay, now Chris came to me. Chris is the dentist I'm working with, and he came to me, when was it, in April, saying, well, you know, you mind doing this test on me? Because he saw I did it on a few patients. And he didn't really feel bad. He felt like most dentists do, a little fatigued, a little kind of slow, and just didn't have the zest for life anymore that he used to have. And he looks good, he's young, he's dynamic, he has a beautiful family. There's no reasons in his life to not feel good, but he just kind of didn't feel great. So we did the first test, and they said, oh yeah, sure, you know, you're going to be really toxic out the kazoo with mercury, and we get that out of you, and everything is going to be fine. So we did the first test. He got 27.8 micrograms per 24 hours. You see here on the scale, a little bit higher than the other folks that we saw, but not as high as some of the dentists that I've seen. I said, shit, you know, maybe there's something else going on in him. Maybe my diagnosis isn't right. Maybe I'm overlooking. Maybe he's dying of cancer or something other, you know, so that I don't know. But the interesting was that after I gave him the shot, I asked him, how are you feeling? He said, well, I felt better for a few days or so, right? He felt clearly better. And then and you see here the heavy metals, the other heavy metals that come out. Just look on the lower thing, a little bit of lead, a little bit cobalt, a little vanadium, but nothing dramatic in terms of things. I think, well, he's pretty clean inside, he just got some mercury, but nothing much else. But the interesting thing was, he felt better, and then he started going downhill again, right? 3 weeks later, he started going downhill again. Next, overhead. Now look at this. And the interesting thing is this G goes to all of you. Yeah, if any one of you would do this test, you would follow the same or similar curve. Chris is somebody who's been mercury-free. How long have you been mercury-free in your practice? 8 years. Since 8 years. He's been on all the programs. He's been taking vitamin C up to here. He's been doing the selenium and everything that you guys are probably doing, or most of you are doing. He's taking all the precautions. He has a high suction and the ventilation and the rubber dam and the, you know, everything that you ever heard about. And he's one of the most responsible guys in terms of handling this stuff. So he's not somebody who's your average John Doe dentist, because I've tested those. You know, you do the first DMPS shot and they get sick like a dog, and you know their mercury levels are off the scale, you know, with the first shot. But he wasn't like that. But look at this. Now, my question to you is like, you know, the first level was here, now the second level is here. Why didn't we get this level with the first shot? What? The mercury that's coming out now was inside his cells. It wasn't in the connective tissue space in the ground system. It was inside the cells. And the same is true, like, where does this tin come on suddenly? Did he kind of swallow a dose of, you know, did he swallow a pound of tin meanwhile? No, the tin that's coming out now was inside his cells, screwing him up. And the stuff inside the cells, that's what's giving you the fatigue. That's what's giving you the cancer. That's what's giving you the chronic severe illness. Now, neurological symptoms, numbness, pain, that's extracellular mercury and heavy metals. Yeah? But the fatigue and the cancer and the serious things, that's intracellular mercury. Okay, next slide. And then we did a third one. And you see now his mercury level is coming down. That means we mobilize now what's inside the cells, and we're getting now a true reading of what's in him, and the levels are coming down. He still has an astronomical tin level, lead, and all the stuff is nicely coming out now out of his system. It's flowing out, that the body is... How are you feeling, Chris? A lot better. Yeah. So he's feeling now stably a lot better than he felt in the beginning. He's no longer relapsing because the stuff from the inside the cells is mobilized, it's moved outside. So he's reached a stable point. The stuff is now easy to grab up with our medication and throw out.
This was the third injection?
There was, well, actually there were between injections, we had in between these things, there was 1 or 2 injections where we even didn't do a mercury test. That's kind of, you know, because it's kind of bothersome to, you know, he was kind enough to collect his urine as many times as he did, but it's kind of a bothersome job going to a restaurant, you know, with your container and stuff. So he had, this was, I believe that was his 5th shot. I believe there was 1 shot in between each of these.
How many shots can you do?
How frequently too?
Once a month is safe. Once a month is
Some
safe.
guys do
How long?
3 a week in toxic patients without side
Yeah.
effects. So it depends on the patient.
Yeah.
Some
Yeah.
people need 1 cc a week. Some people need 3 shots, 3 ampules a week.
Yeah. my recommended program right now is once a month until you're clean. But hold your questions back, because all this is changing with what I'm going to say next. Next. Okay, Joel Tartel. He is a pharmacist from New York, who's been disabled now for 2 or 3 years. Walks on a cane, severe neurological illness. He can't remember his own name most of the time. Beautiful guy. That was his first test that we did in July. You see his mercury level moderately elevated. Now remember, in my experience now, anything over 2.0 that comes out means that he has enough mercury to block the excretion of everything else. Yes? So if any one of you finds you have a higher level than 2, you're going to have a lot of crud in you that you don't know about. So this was his first test. You see a little elevated lead and significantly elevated tin. Now I worked with this man for a few months. Gave him a few, well, no, actually I didn't give him, because I didn't believe that was the cause of his problem. See, like, this is all new for me myself. I just kind of stumbled into this by doing these tests and said, oh my God, you know, because suddenly coming back, like with Chris, and just keeping up with the shots, I suddenly realized, God, my God, these people are getting well. You know, people with MS, people with ALS, people with chronic pain syndromes. Let's do the next slide. So I worked with him for a few months, IV nutrition, IV minerals a lot, neural therapy, and he gradually plodded along, but didn't really have quite a breakthrough. And so I said, well, shit, you know, I really need to go back to my DMPS. So I did this shot that was only on 9:15. You see now, like with the detox program, I had him on, the mercury level came down real nicely. But look at what happened to him now. You know, see what's coming out of his cells, what he had in there. Yeah? Zirconium, by the way, a really mean, nasty mineral that I've seen some severe neurological illness from it.
Where would you fit in mercury levels from the feces in this? In other words, would you take a baseline and then maybe the total in or what?
Well, the mercury levels from the feces, you know, first of all, one should take them when you work with DMPS, with DMSA, you know, because that's where it goes out. But I don't know, you know. I think this test is very elegant, you know. I don't like to handle certain things, and the urine is sort of very clean to handle and very, you know, easy to ship off, and you kind of don't have to get involved with.
These patients now, like this patient, they had their amalgam removed from their mouth
Yeah.
at this point?
Yeah, yeah. He had Chris removed his fillings. Let's go back to the last slide, so just kind of see the difference and appreciate the difference in what we're finding here. Because with this patient, here's the first one where we did something I'm going to talk about next. This was our original test that we did the day after his fillings were taken out. Yeah? I usually don't give any of the chemical detox agents while people still have mercury in their mouth, because all that's going to happen is that through the saliva, through the ionic mechanism in the saliva, the DMPS, which builds up quite strong in the saliva, all it's going to do is going to saturate itself on the surfaces of the fillings, clean up your fillings, and kind of come out in the urine. And the reason those studies from Downderer and the University of Arizona are, in my opinion, a little crummy is because they find, you know, that the urine excretion of mercury correlates directly with the number of exposed surfaces in the teeth, concluding that it must be the more surface you have, the more you have in the body. But in my opinion, because I know it gets in the saliva, it just kind of goes straight in the saliva, saturates itself while circulating through your mouth. And of course then, the more mercury you have in the mouth, the more comes out. But it's not the mercury in the mouth that we're concerned about. Let's hold back questions for a moment. I did one new thing on this patient, and that is that we put him, you see this level here, 18.4, and you see how blocked he was, and he had severe neurological illness. Now, in the last 2 weeks before we did the next test, we put him on chlorella, and that's what I'm going to talk about next. And I'll show the next slide again. And you see how whatever program, let's put it this way, how whatever program I had him on how tremendously that mobilizes his heavy metals from the inside of the cells into the extracellular space and out in the urine. And it was after this shot that the patient threw his cane away. It was after the second shot. And that was the shortest success I had. It was 2 weeks of chlorella and the shot, and he got up and threw his cane away. Okay, next slide.
What is it you gave him?
I'll talk about that now. Now, me and a bunch of other practitioners, but especially Louisa, who is both a chiropractor and naturopath in Seattle, who is a very close friend of mine, we've been looking at this issue. There must be a better way of doing detox. There must be a more natural way. There must be a way of doing it without chemicals. And we've looked at all the programs that are out there. And like we're using kinesiology. The wonderful thing about kinesiology is that if you do a test like this, it costs the patient $200 each time between the shot and the urine test. And when you use kinesiology, it takes 2 minutes. It doesn't cost anything. And you can very quickly predict what it's going to do. And Louisa came up with this agent, and simultaneously, independent of her work, I found a book that was just released about 2 months ago, 3 months ago by CRC Press, called Biosorption of Heavy Metals. It's written for gold miners and the mining industry. It's a book that describes, like when you have an old gold mine and there's all this gold dust lying around, how can you translate that into money? And next slide. Now, there's a chapter in there, and when I saw that chapter, my heart started jumping a little higher. It was called Algal Uptake of Heavy Metals. Biosorption refers to a process that biological membranes of certain animal species, plant species, and microbes absorb heavy metals into their surface and have a very high affinity to heavy metals. And algae are one of them. And there's a chapter here discussing how the membrane of certain algae takes copper, lead, zinc, mercury, cadmium, nickel, cobalt, arsenic. All the metals that we're talking about are being uptaken by these membranes. Next slide. And then these are some articles that we found looking through the book. Mercury removal by immobilized algae in batch culture system. If you put mercury in water and throw some algae in there, within a few minutes all the mercury is in the algae and none is in the water anymore. Next one. Just going through a few things here. Now, the highlighted portion here, utilizing chlorella and studying the uptake of zinc and mercury by the living algae. Next slide. These are just some highlights in the book, and I just want to tell you how I got to where I'm at now so you can follow me. Cadmium binding component of chlorella. Chlorella, and this is the same kind that we're using now, pyrenodosa, accumulated cadmium, tolerated high intracellular cadmium levels. Okay, next one. This is the uptake of gold. 90% of gold was recovered by this algae, by chlorella. 90% of gold was recovered. It means what they're doing, they're spraying water in these gold mines, and then when the water runs off, they're running it through a filter that's full of chlorella, and the water kind of comes out this end, the algae stays in there, and then they take the algae and through a certain chemical process get the gold out of it. And of course, when I read that, my heart was jumping higher and said, shit, if you can get some of this chlorella in us, it should be able to take out the mercury and cadmium, nickel and copper. And as it turns out, the people that market this product have over 150 references of how to use chlorella for detox from heavy metals.
Are you able to remove the heavy metals from the cells?
Yes. I described the process in a moment from what I understand. Just from now, the latest, I have now a whole bunch of heavy metal urine tests like the ones that I showed you, but none of them were back in the mail yet to me, so I couldn't show them because this is very new for us too. But the detox results following them with the DMPS monitoring are very, very dramatic, and that's why I'm saying this here. Okay.
Still use DMPS?
No, but I get to that in a moment. Chlorella works also for CMV, Epstein-Barr, other viral infections. Next one. Restore immune functions, for treatment of malignancies, and of course, if I'm saying, and I know that I'm right, that the chlorella gets the heavy metals out of the cells back into the connective tissue, and I said earlier, what's causing cancer and heavy metal toxicity is not the heavy metals that are in the connective tissue, it's the heavy metals that have entered inside the cells and are changing the DNA and RNA. That's where your cancer comes from. And if you have a mechanism of getting it out of the cells, we can treat cancer with the same agent. And as it turns out, there's a whole bunch of articles on treatment of different cancers. I just show you one here. The next one. Anti-tumor immunity. Of course, these folks that write these articles don't understand the ionic channels and what happens in heavy metals. They just give people chlorella and they find that cancer goes away. But there's a big black hole in the middle that I'm trying to fill here with my talk, giving you some understanding what may happen in the middle. Now, okay, before I talk about our current detox program that has evolved from this, I want to just kind of give you the mechanism of biosorption. Yeah? Chlorella and certain other yeasts and bacteria have membranes that absorb very strongly heavy metals into them. The same process by which heavy metals get into your body cells, but your body cells have a low affinity for it. But it ends up there because of the concentration and the chronicity. It ends up inside your cells and in the extracellular space. If we swallow chlorella, two things happen. One, first of all, it's only a certain kind of chlorella where the cell wall is broken down in a certain way, so it ends up in two kinds of particles. One is a very fine particle that gets absorbed into your bloodstream and is responsible for absorbing heavy metals out of the cells. Another bigger particle stays in the gut and works like an ion exchange resin. That means the blood circulating through the gut wall exchanges the heavy metals circulating in the blood with the membranes that are inside your gut, getting the heavy metals out of the bloodstream. So we're taking care of both components of the heavy metals with this. We're getting it out of the cells, we're getting it out of the body. Now, admittedly, we have still a little problem with that the kidneys can sometimes get plugged up with giving too much chlorella too soon, and we are very careful with the instruction we give to the patient. And this is our current detox program that we use. We start with 4 capsules a day. Now, we have on the program here 2 in the morning, 2 before bed. If you, like me, are a chronic insomniac, you take all the 4 at night because it has a high tryptophan content. It's a wonderful way of getting tryptophan into you, wonderful way of putting you to sleep. Now, in the kidney, there's two ways of, when you have heavy metals bound to the chlorella membrane, there's 2 ways of getting it out of the chlorella membrane into free space or into water. One is by combining the mercury, copper, nickel, lead, whatever you have in there, with ammonia. And there's a product from Standard Process called Calamo. It's a form of ammonia that very strongly binds the mercury stronger into itself than the chlorella membrane does. And that way we get it out in the urine. The other way we get it out in the urine is for creating a urea that has a sulfur in it. And so we don't have that on here, but the cysteine is the amino acid, one of the wonderful ways of getting sulfur in your system. And AC carbamide is urea. So we need the urea component and we need the sulfur component. This is one suggestion we make here. Either you take straight cysteine or N-acetylcysteine like I recommended before, and that hasn't changed. Or you take this product here which has all the antioxidants in it. There's still a place for those, selenium and so on and so forth. And by giving this and the urea, you're creating a compound that can exchange the heavy metals from the chlorella membranes that are circulating in your bloodstream, in the kidneys, back into the urine and out. Yeah? And you don't have to do any of this. As long as you do the chlorella, it's going to come out through your gut. But your kidneys may suffer a little bit in the process, and so this is a way of stopping the kidneys from suffering. And currently, I look at our detox program in this way, that the DMPS was a great way of monitoring our various detox programs and see which ones work. And like I said before, none of the detox programs that we've monitored from before have worked. And this is one. I have now 5 or 6 patients that I've had long enough on the chlorella who had dramatic drops in the mercury levels and dramatic spilling out of lead and arsenic and toxins from just having been 2 weeks on the chlorella. There's a massive detox going on, which can be a little severe on the body sometimes.
Tell them that's in their packet so they don't copy that all down.
Yeah, that's in your handout, the program here. Well, that's of course what I'm doing right now to monitor it. But see, like my feeling, now let me just kind of go back to you as Dennis. My feeling is that you should get current with your mercury levels and your heavy metal levels, because you're all up to the kazoo full because of your past. You can't help it. And in order to get current, I still recommend, because the expense for you is relatively small, to do a DMPS test, get the urine collected, check out what are your beginning levels, then do one shot 4 weeks later, don't collect your urine, do another shot a month later, collect your urine again, see where you're at. But do the chlorella while you're doing it. And usually with the chlorella on board, it won't take more than 1 month for you to be current on all your levels. It is so dramatic what is coming out. Okay, we have, this is a bunch of references. This is something else here. We don't need that. Okay, you can switch the machine off. Now, how much time do I have for the... How much time do I have? 10 minutes. Now, I wanted to, as part of the lecture here, I wanted to show you how we use kinesiology to monitor all this and find out who's toxic and who's not toxic. And we've developed a very simple way. See, like kinesiology, there's kinesiology and there's kinesiology. And I have the advantage of being able to monitor my kinesiology with my objective tests. And what we found is that we can, with kinesiology, very exactly predict how much extracellular mercury and amalgam residues you have. So far, I don't have a way of monitoring the intracellular stuff, but we can monitor the extracellular stuff through a very simple testing procedure. When you have, oh, by the way, the chlorella, there's different kinds of chlorella out on the market. The one that we recommend is the one that works because the cell wall is cracked in a very certain way. Unfortunately, it's a network marketing thing. We're not so happy with that, but that's the only way you can get to it. Louisa brought a whole box for us here. I recommend all of you, and this is not a business thing, so I just really feel that this is the way to go. That those of you who are interested, buy a bottle for yourself, just one, take it for a while and just see for yourself. And if you get interested in it, like that may be the way to protect your patients. You put them on the program before. This is the only detox program that is safe to put your patient on before you take the fillings out. I've seen horrible things happening from those of you who start taking the fillings out and start the detox in the middle of the fillings. Now what happens, the detox agents that you all used have pulled out the mercury out of the residual teeth that still have mercury and get the toxicity levels way up. And I've seen a lot of people that shut down kidneys and brains and nervous systems that takes them years to recover. This is safe to start before you ever do any dental work, 2 weeks, 3 weeks before. You start them on it. You have them on it while you're on the program. It grabs the mercury that floats around after you re-inhale it, and keeps your patient protected during the whole course of the thing. And you keep them on the chlorella for 6 months afterwards. It's too early to say whether you really need to, but chlorella got all the amino acids in it, all the minerals and everything else. It's the ideal food supplement anyway. So you're combining the best of detox and the best of supplementation by doing it. I recommend those of you who feel like it and you get a bottle from us, try it out. If you feel like it, then sort of call the company, and get involved in giving that to your patients. I feel it's the ideal thing that we found so far.
For dentists who are nursing mothers,
Yeah.
should they wait until they finish weaning prior to doing the?
No, I think you should go on it right away. Because, when you're nursing all your mercury into the baby, and you try to, if you have the chlorella mercury complexes circulating in you, at least it doesn't get in the milk.
Detox program, you said keep the patients on the chlorella. Do you keep them on all of these?
Well, it depends. For the detox from the patient, I feel it's important to add those other ingredients in to make it. The patient's going to get. It's a possibility the patient's going to get sick. You can just put him on the chlorella. If he does well, don't worry. But if you get sick, it means your kidneys are getting plugged up, and you need to put them on the other agents. If you got in the handout, there's a phone numbers where you get everything and stuff for that.
And the chlorella has all these amino acids and minerals in it.
Yeah.
This formulation.
No. There is. You just look in your handout. We got the whole thing outlined in there of what we recommend.
Is this the composition of the chlorella?
Yeah.
So it has all of these.
Yeah, but sure. Yeah, but it is not enough. You need still a sulfur-containing amino acid in order to provide sulfur to get the chlorella mercury complexes out of the kidneys. Yeah, and that's
Is this regimen safe for any age?
yeah.
You can do.
Yeah, from what we know so far, yeah. Yeah. And sometimes when the patient starts feeling unwell, usually they feel better right away, and then they start mobilizing the stuff out of the cells, and then they start going downhill. And that's when you want to add in the other things, and back down with the chlorella, to 2 a day, 1 a day. Stay there, and then gradually nudge your way back up, because you're going to flush out lead and cadmium, all the stuff is coming out like a waterfall.
So I just want to make sure I'm understanding this. And you start everybody on everything all at one time, or start?
No, I start on the chlorella and reserve the rest of. I start on the chlorella and the antioxidants. Yeah,
Which is
the what's it called? Biotech. Bioprotect and the vitamin C. That's common sense. Everyone should be on that. And the calamo really takes the edge off the detox reactions. Now the AC carbamide works as a diuretic, and it's a very mild, gentle diuretic. But I don't put everyone on that immediately. Only when there's a kidney problem, I put them on the AC carbamide. Jess?
Dietrich, it would be well to remind everyone that there is a lot of chlorella, spirulina, and other algal products that are grown with sea salt that pick up all the pollution
all the
and
dirt,
trash
yeah.
with it, so
Yeah.
don't just grab any
Yeah,
chlorella.
no, it has to be this chlorella. That's the one that's testing with the kinesiology, and that's the one that works. Yeah, I find, I've seen people horribly sick from spirulina and other things because of what's in there with it. And
Where did you say to use the NAC? Is it instead of the BioProtect or in addition to it?
no, instead,
Instead,
yeah,
one or the
yeah.
other?
NAC is a little stronger, but we try to kind of keep a simple program, yeah. So you just go on the chlorella, and if there's a problem, you can take the NAC, there'll be muscle test for it, or the calamo, or the AC carbamide. Each one of them will take the edge off it.
Right.
But the sicker the patient gets with the detox, the more comes out, the more you want to add in of all these things.
Right, but it's NAC or BioProtect, you don't use both.
Well, the BioProtect has the selenium and a few other things that make good common sense on the long run. Yeah. But if you go through an acute phase, I think the NAC is better.
Did you test sun chlorella?
Yes. Yes, it didn't test, yeah.
Peter, there's an NAC in the bioprotector, just not enough.
I know, yeah.
So you, Louise, you use it in addition to both?
With Alzheimer's, yes, of course, yeah. Alzheimer's, you know, for me is the late outcome of intracellular heavy metal toxicity. And now, the chlorella is too young for me to know, but I've treated Alzheimer's patients with DMPS shots in my old N-acetylcysteine with wonderful results. You know, the brains come, it takes a while, you know, because there's a lot of actually permanent destruction in the cells. And it takes a while for other parts of the brain to pick up and come around. It takes about a year for an Alzheimer's patient to really start on an uphill curve.
Peter, can I say something on chlorella? There's a research article that says that chlorella binds specifically to aluminum. So that's one of the metals that's covered too.
That's a major problem.
How about Parkinson's?
Parkinson's, you always have to look for the dental focus. Yeah, usually Parkinson's is a combination of a focus creating an electrical situation where your pores don't work, and then you accumulate the heavy metals. So first you have to resolve the focus, which usually is a dental focus. Yeah, and Chris is going to talk about those. So usually with Parkinson's, you always find a dental focus, an old osteomyelitis in the jaw, wisdom tooth area, usually the uppers, and you resolve that.
After the metals are out, though.
After the metals are out. Then usually in addition in Parkinson's, it's different in Parkinson's, you usually have a dental focus. Usually it's an upper molar or wisdom tooth, or in that area a jaw osteomyelitis. And they either use Dawn's laser, or you do the bone cavitation work, and then you detox the patient. And then very predictably they come around. They're very difficult cases, but because you have to do all of these things.
Can you make a comment about the rate of removal of the different materials, whether you do it a section at a time?
Yeah.
Or all at one time?
Yeah, my latest thinking on that is, now remember, like I had my fillings taken out all on the same day, and I died of kidney failure 6 weeks later. But that was, you know, traveling overland to India and having at least 17 bouts of diarrhea, you know, in the following few days, being completely dehydrated, not being on any detox program. I feel now confident that our detox program, combined with drinking a lot of water, and good water, yeah, is so powerful and is so reliable that I feel right now it is best to take the fillings out, if you can, all in the same day. And here's the reason why. What happens, and we've tested with kinesiology, you take the first quadrant out, you release all the mercury vapors, you re-inhale them, and you get in a semi-acute, very reactive allergic state towards the amalgam. And all of you who have done the work know that. Patient does great with the first quadrant, he does even better after the second quadrant, and after the third quadrant he doesn't even come to you, he comes to me on the wheelchair or kind of crawling and says, "Doc, I'm feeling so bad." And when we're testing him, he's in an acute, it's not the toxic state, it's an acute allergic state. He became so sensitized towards the mercury vapors that he's now completely collapsing under you. And we find, like, since I'm trying to get people through the work as quick as possible with Chris, and do the work in a very rapid order, that we don't have this problem anymore. You know, they come in, after the removal, they get immediately the DMPS shot. I do give them vitamin C afterwards to prevent some of the damage, you know, of the cells, and prevent some of the fatigue and all that. But I right now recommend all of you who are using this detox program that is now reliable and detox, it really gets the job done. Yeah. So far we didn't have anything that really got the job done. We thought we did, but we really didn't. You know? Like I have people, you know, when all these studies that are done, you know, that show, you know, when you put mercury fillings in, that the patient is quite toxic, and then toxicity level goes away over a few months. All the studies do one thing. They all assume that the mercury level goes down because the mercury is gradually leaving the body. But it's not so. The body, the mercury is going inside the cells, and therefore the person becomes functional again. The autonomic nervous system becomes functional because it's not in there, it's in the cells now. And that's the tragedy. You know, the whole world has gone wrong on that issue. The mercury doesn't come out, and nobody has ever proven that it does come out through the stool or the kidneys. It's just to show the kidney excretion goes down over a few months and then goes back to normal, and everyone always assumed that the mercury issue is therefore not so hot. But when we do these tests, we find it in this, like with Chris, you know, we find it in your cells, you know. It just can't come out anymore. And so I recommend like the removal as quick as possible, even in subsequent days, you know, take a week, really get the stuff out of there, have the patient on a stable detox program, give him a DMPS shot afterwards if he can, or have them on high doses of chlorella during those days to immediately bond the material. And you won't see those problems. The patient won't collapse on you like they used to. You know, they won't drag in with their chronic fatigue. Ed? Hang on, Ed is saying.
In Germany now, they've started removing all of the amalgams in one shot, plus doing all the cavitations, all the bone cleaning, all in one day.
Yeah, yeah.
I myself, I think that may not be the right way to go unless you're in a hospital.
Yeah, yeah. One comment to that, you know, when you do bone cavitation work, you have to do the fillings first. If you still have a toxic mouth or electrogalvanism and try to do bone cavitation, it's predictable, this thing going to get infected, it's going to just perpetuate that we go through all these huge surgeries and expensive, and it's not going to do the job because your immune system is still paralyzed from all the toxicity. So it has to be in sequence. Fillings first, detox, and then the bone cavitation. And I think we should put a few weeks in between, you know, personally.
Where do you put the neural?
Hang on.
Dietrich, in the past, I've been really against the strain because I've taken a lot of them out in one day. The one big thing I've done different though is I've been taking antioxidants and I've been sprinkling them on the floor of the mouth and the upper mucosa everywhere, okay? Do you have any idea on why that might, if it is helping?
Well, the antioxidants don't detox the patient, but what they do, they prevent the mercury from doing the damage that it otherwise would do. It's still there, but it's not doing the damage. But as soon as you stop the antioxidants, it'll be there and
No,
exert.
what I'm saying is I'm sprinkling it on the floor of the mouth when I'm taking the fillings out.
Well, I think that's a great idea. Yeah. Oh, I think, you know, we should work with the antioxidant and should do all that. All I'm saying here with my talk is that wasn't enough.
Yeah.
You know, that's all I'm saying with my talk here is like whatever we've been doing so far wasn't enough. That there's stuff inside your cells, everyone here in the room, you know, so that you didn't know was there. You know.
What percentage of the sickness effect do you think is allergy?
In the after taking the fillings out, or I think about 90%.
So
Yeah.
if you had a way of handling the allergy part, you probably could,
Yeah.
through another approach.
Yeah, and
control
that's
it, right?
exactly what we're doing. You know, when we can't do it in a very short period of time, we treat the allergic components with various means.
I'd like your opinion on whether, at what points within pregnancy and during nursing, filling should be removed. Say you have a woman who wants her fillings removed, but she says, well, I think I'm pregnant. Well, then she has the baby, then she's nursing, then pretty soon she's pregnant again. And so the point is...
Well, I think, first of all, the DMPS, there's no teratogenic effect, there's no effect on pregnancy. DMPS is an extreme safe drug, even though it's not FDA approved. I need to say that here, you know, for those of you. So you want to find your own way of working with it, even though it's easy to get through a registered pharmacy, and when you get it here inside the country, you're somewhat on firm ground with it. It's an extreme safe agent. You get some skin reactions in the literature. I've done well over 500 shots and haven't seen one problem with it. I mean, it's one of the most beautiful drugs. And but I recommend if you have a pregnant woman, you just use the chlorella and the antioxidants.
and go ahead and take them out so she's not exposing the baby to further exposures.
No, I think you're safer with taking them out than with leaving them in.
Yeah, okay.
A couple of questions. One is you mentioned not to use DMPS if you haven't removed the
Yes, yes.
amalgams.
I think it's a crime.
How about any other kind of metals in the mouth, gold or something?
Well, gold is relatively stable in the mouth and leaks out at a much slower rate. And so you can do detox programs with the more stable metals in the mouth. Yeah.
Okay. Another question. Also, you mentioned how there could be some kidney problems or congestion.
Yeah.
And you start doing this detox, and so you gave a protocol for that. For those of us who are able, sort of adept with using different kinds of drainage remedies,
in your opinion, is
Yeah.
an adequate?
Yeah, sure. Yeah, yeah. That's probably going to be the solution. I just didn't want to mention that here because it gets confusing to some of the newcomers in the field. But the homeopathic and herbal drainage remedies work very well in opening up the pores and the channels in the kidneys and getting stuff through. But it's not as reliable. You need to have a testing way, either kinesiology or electroacupuncture or dowsing or whatever you use to find the exact remedy. You have to be the spectrum is very small with the homeopathy. You know, and we're looking for a wide range kind of stuff that works for everyone, and that's what's in the program. Ed?
Well, for the dentist should work with a physician on this detox thing. And it's really important, especially if you're going to be using an unapproved FDA drug. The physician can use it for another purpose. If they've approved it for one thing, he can use it for another thing.
Let me kind of just revamp of what I want you to do. I want you to put all your patients on the chlorella as a safeguard where I know this patient is going to be well. A few months down the road, all the stuff is going to be out of him one way or another just by having him on the chlorella. The additional things that we've listed in the detox program is going to help you if you put him on that if the patient goes through a detox crisis. You can either reduce the chlorella or you add in these other things. You can play with that, but the chlorella has to be the constant. You don't use the DMPS on your patients because it's not in the FDA way safe. The DMPS I want you to use for yourself, and that please keep the focus on yourself. You are the ones who are exposed to the mercury, and you are the ones who need the extra dose. And it's $62 a vial, you know, so 5 times that is going to get you current for the rest of your life. You're going to be okay. You know, so there's $300 expense, and you're going to be detoxed to a degree that you're going to be healthier than any of your patients. George?
That's U.S. purchase price or in Canada?
No, that's the U.S. price. You can't get DMPS in Canada easier than here. College Pharmacy is the only place I know where you can get it. No. DMSA you can get in Canada. Now DMSA, for those of you who have neurological problems, numbness, the memory is starting to go, that's a good way to follow up with DMSA, but with the chlorella you don't need it. You know, chlorella is going to get it out of your cells in the brain. So chlorella doesn't know a blood-brain barrier. There's only certain drugs that know that.
Yes, earlier, did you say that when using non-metallic restorations, that glass ionomers would be the best choice?
In terms of the testing, and I hope maybe at the end of Chris's talk, maybe we get a few minutes to demonstrate the kinesiology, the muscle testing, and I can show you the people who have plastic fillings of how it affects the higher levels of your being, and the glass ionomers don't. Yeah, so there is a thing that we can't measure with electroacupuncture. Yeah, it's not something that will show up in that kind of testing. It's a higher level that the problem is on. But I recommend to go out of your way to find a glass ionomer that matches the patient rather than jumping to the plastics. And again, you need Jess Clifford's test for that to just kind of very quickly screen. You know, here's my glass ionomers, and that's the one that fits the patient. And I'm taking that rather than saying, well, there's a glass ionomer here, but I don't have it in my toolkit. But I got this nice plastic here, and I'm going to do this. Get kind of equipped with a bunch of them. Okay.
This is a question directed maybe more at the dentists that are working with you, but you're talking about taking out all the amalgam in one day. That can be a relatively short procedure. Restoring all those teeth is where we get involved with time.
Yeah.
Do they very often find it well to leave the patient bare and then put the restorations back in incrementally?
Let me tell you how the Germans are doing that, and I think that's the intelligent way of doing it. You take all the fillings out in one day, and you put nice porous temporaries in there, because it's been proven that for about 3 months you degas amalgam from those teeth. That means sometimes you can get away with leaving the little hue of amalgam still in there, but not breaking into the pulp chamber and creating other problems, a dead tooth or a root canal or something down the line. Leaving a little bit in there, putting a temporary filling on there, and it will start to degas over a 3 month period or so. And then leisurely, 3 months you wait, and then you start putting your restorations in. Also, the best time of doing your allergy testing for the materials is about 2 months after the fillings are all out and you detox. you're going to get a very different profile in terms of the allergies. Now, I can't prove that, and Jess knows a lot more about that, but my feeling was with the testing, at least when we use kinesiology, that your testing changes, your range gets broader, you become unallergic to so many things. Certain allergies are only triggered by the presence of the mercury toxicity. Yeah, once that's out, you have a broader range of materials you can choose from. So the best time to test is, like 2 months after the fillings are out, let them degas. If you have a patient who can handle having temporary fillings in there for a few months, it's the best way and the safest way to go.
As a temporary with the glass ionomer device? Or is that
No, you want to just use a cement, just a straight. I don't know much about temporary fillings. You want to use, the Germans say, a porous, breathing filling, and they just use. Yeah, Ed, what would that be? No, we're just talking about this as plain cement. This something.
They were using IRM.
No.
You use Duralon,
Duralon, yeah, probably.
That's what they're like.
Tylac Plus.
No, the ionomer one from Kenmap.
Oh, Jerry still?
There's a couple of different glass
Jerry
ionomers.
Well, those are not porous. I think the major problem is in our minds about leaving the patient bare. If they go on avoid hot and cold and sweets.
Sure. No, I know that.
They
No,
can
I know
handle
that there's a
too.
problem. It depends on, if you have an MS patient or cancer patient, and you have a chronic underlying disease, then I want you to do that. Kind of go out of your way, leave this thing as open as you can, let it degas and stuff. If you have a patient who is just doing it for cosmetic reasons, of course, then you put the fillings in right away, and you seal it up. But there's sort of a spectrum between that patient and that patient. We need to use your own judgment on it, on doing that. And we can ask in Germany what the folks are using there, but Fritz and the other guys, they told me they just use a plain cement, and I don't know what that means, that they smear in there.
Duralon is about the best.
You can put mask in Duralon and then it doesn't bond like very well. Mask is a silicone.
Let's find out when we're in Germany. You call Ed on that issue in about 2 weeks when we get back, and we've talked to the guys then. Yeah. Okay, any last question?
When you say removing metals, does that include some gold alloys? I mean, there's so many different gold alloys out there.
Well, it depends, that's something you need to test for. First always you get the toxic metals out. Yeah. Toxicity is the main problem. Then you have allergy as the next problem, where you can be allergic to the various alloys. And the allergy, I have a way of changing the allergy towards that. And various people have various ways of doing that. So often you can get away with leaving those in. You cannot get away with electrogalvanism. It's one of the nastiest ones. If you have 2 different metals in the mouth, I haven't managed, I had an osteopath I worked with who could change silver fillings into gold fillings by using some psychic, okay, thanks. But by using some psychic force, it was visible. You could look in the mouth of the patient, and he was holding this little magical flashlight in there, and while looking, so the silver was clearly changing to a nice shiny gold, and about half the patients could keep it, would stay that way. But when we would measure, it would still be toxic, and it still would have the electrogalvanism. So it was mostly a cosmetic kind of psychic thing, that he did, and interested in that, So electrogalvanism you have to resolve, but you can get away with certain gold alloys, with certain methods of desensitizing, and it's a matter of my summation theory. If you get everything else right in the patient, your biochemistry, the structure, the brain, therapy, emotional release type of stuff, then you can get away with 1 or 2 bad things in the mouth. It's a matter of summation. Gary?
What are you finding out when you're testing with these composites that test so high in millivolts?
Well, I really so I'm not,
They're compatible on the Clifford report.
Yeah. you know, first of all, I mean, the trouble with that we're talking different languages, because with me it's also like I treat every patient with neural therapy first, and Don was